Welcome to today's lesson on disease transmission. My name is Isaac, and we will talk about the science behind how diseases travel, focusing on the 6 F's, which is an essential framework that holds the key to understanding and breaking down the chain of transmission. Diarrhea is a symptom of many diseases, and it can help us to understand how infections spread. So the process starts with a source of infection. This could be a person or agent that discharges infected feces into the environment. So from there, the infection spread through the different pathways. And to make it easier to understand, we are going to use the 6 F's: feces, fluids, fingers, fries, fomites or fields, and food. Let's break them down step by step. It all starts with feces, which are discharged by an infected person or a carrier. Then these feces are left on an open space or near water sources, and they can spread harmful germs into the environment. For example, when it rains, feces can get washed into rivers, which people may use for drinking water, and this can make them sick. Next, we have fluids. These include water or other liquids that become contaminated with germs from infected feces. For instance, if people drink water from a contaminated well or river, they can get sick. Let's talk about fingers. Our hands can pick up bacteria and viruses if we touch contaminated water, feces, or surfaces. And if we touch our mouth or food without washing our hands, we can get infected. For example, a child who doesn't wash their hands after using the toilet can spread germs to themselves or others. Next, we have flies. So flies are small but dangerous carriers of diseases. They land on infected feces and then move to food, spreading germs along the way. For instance, if flies land on exposed food in your kitchen, they can bring germs from dirty place outside. Then we have fomites or fields. Fomites are objects that can carry germs such as cups, plates, or any other surfaces that can come into contact with the food or water. For example, if a dirty plate is used to serve food, germs on it can be transferred to the food and cause illness. Finally, we have food. Food can get contaminated in many ways: through dirty water, unwashed hands, fries, or dirty surfaces. The good example I can give is imagining eating food that was washed in dirty water or handled by someone who didn't wash their hands. The food can carry germs that can cause disease. Having talked about how disease can be transmitted, starting from feces, through flies, fingers, fomites, and fluids. Now, what are some of the barriers that can be placed in order to prevent the disease transmission? Let's look at the barriers we can use to stop diseases like diarrhea from spreading. Proper sanitation. Use toilets or latrines to safely manage waste, and this prevents feces from contaminating the environment. Safe water supply. Always drink clean and treated water, and protect water sources from contamination by keeping them covered and safe. Good hygiene. Wash your hands with soap and clean water after using the toilet, before eating and before preparing food. Food safety. Wash, cook, and store food properly to keep it free from germs. Clean surfaces. Keep dishes, utensils, and surfaces clean, and disinfect surfaces to stop germs from spreading. And lastly, proper waste management. Dispose of waste properly to reduce environmental contamination. We can say that diseases like diarrhea can spread through 6 pathways, which is feces, fluids, fingers, flies, fomites or fields, and food. But by using simple barriers like clean water, proper sanitation, and good hygiene, we can stop these diseases from spreading. Thank you for watching, and if you found this video helpful, don't forget to like, share, and subscribe for more lessons on health and safety. Together we can build healthier communities.